discuss about the term primary care. Before we talk about primary care, we should know what is primary health care. Primary health care is a concept. It was developed in 1978 in WHO. It was to say how the people can access the health from their doorstep. The concept was developed. It was been into a university system. Now university has departments. Now primary health care is one of the departments to concentrate on primary health care. Within the primary health care broader concept, primary care comes. The primary care is a community-based clinical medicine. Then when we call in academic term, there is an academic discipline under family medicine. Family medicine comes under the primary care discipline. Now when we want to connect what is primary care, we are going to focus the care at the primary care level. That is, we are going to connect the health problems to the health system. Then we say, first contact care. That is a problem of the public, lay person have a health issue, is connecting a doctor. Then doctor is connected by the problem, that is called first contact care or first contact point. Now from the first contact care, we can see one C is developed. With that, we are going to develop another component, continuity of care. This continuity of care can be delivered from primary care. When primary care is developed, the continuity of care is going to come. Then continuity can be anyway, from the patient to the patient, relations and family, and then it can go to generation wise. Or it can from the intrauterine life to the adulthood and as well as the elderly population, it can be continuity of care. That this comes we see continuity as a C. Third part we call is a comprehensive care. This is a total care. We see the patient in all dimensions, physical, social, psychological. Then all dimensions are looked at one point as a comprehensive. That care we are seeing as a holistic approach. Primary care discipline is focusing on comprehensive care. Then it is going to be a first contact care, continuity care, as well as comprehensive care. It can also be cost-effective care. It can be as a cost-effective. How can we say it is cost-effective? We are not going to do unnecessary things for the patient. Primary care level, it is a cost-effective care. And also we can at another C, coordinated care. We are going to coordinate the care to a patient at a different level, maybe to a secondary care level, or even a tertiary care level, or even to a social service or resource problem, where we are going to coordinate. And all these C's are coming under the primary care concept. In addition to that, primary care is ready to do or provide a preventive care. It also can be a personalized care. Then the primary care itself is a patient-centered care. The patient is more than the disease. Now we consider primary care as a patient-centered care. When we talk about patient-centered care, the environment is controlled by the patient rather than by the doctor. When you go to the clinical settings or hospital-based care, most of the environment is controlled by the doctor. Now the patient has little or no autonomy. Here when we talk about the medical ethics, the autonomy is more and more applied in primary care settings. The patient has all the right to talk on their problems and to follow the actions and to take their decision making. That component comes as one of the most important patient control environment. And also the typical consultation process in primary care is atypical, because we focus the patient on their problem rather than the disease. Then we encounter as problem. Then patient present with problems. The problem can be different way. They might come the early stage. That is a challenge now. Without developing the actual disease pattern, they present to the primary care physician and the vague symptoms. Then that becomes a big challenge. How to detect the disease in early stage. Then with the experience, with the available resources and all this the cultural, social information, they make a decision, okay, this is might be due to this issue, then we can make that part with the early stages we manage that. At the same time, the patient can come or access the doctor with the terminal illnesses, maybe the last moment of their life. Therefore, this primary care is going to cover a very important broad spectrum of health problem. It can be asymptomatic, it can be symptomatic, it can be in a terminal with complication. Then family doctor has wanted to develop so many skills, making good therapeutic skills and managerial skills and knowledge skills as well as a good communicator. That communication should be most important skill or element in the discussion of the primary care field. Primary care is almost clinical based, community based discipline. Then patients can access with the doctor, then we talk about accessibility of care. Then we talk about the cost, we think about the affordability of care. The doctor is in the community, we talk about the availability of the care. Then when we talk about this age, it becomes appropriate care. In case is acceptable care, then we can think about the adequate care. Then primary care physicians applies all age. Acceptable care, affordable care, accessibility to the patient, and also he provides adequate care. That means the patient becomes a good doctor in the community. Doctor becomes good doctor in the community as a primary care physician. The primary care practice, we call it a family medicine practice. It is now becoming one of the best discipline in all other countries. In now Sri Lanka, there is a very competitive field now. Patients can work in many places. They can work at home, they can work in office, they can develop hospitals, then they can deliver the service in different places. It is not limited to that. Therefore, primary care becomes one of the more and more popular discipline. It is not, we are going to attend the cases on time. And if this is not there, we are going to refer the patient to another where the patient can get a good journey. We are going to share the responsibility. We are not giving up the patient. We are sharing the responsibility to another resource. It may be a hospital base or it may be a social base. That is the primary care concept. We have to think primary care is the whole holistic, comprehensive care for all levels, all ages, for both males and females. There is no, and also we are traveling through all the disciplines, irrespective of the problem. We can talk about oncology, we can talk about surgery, we can talk about medical, we can talk about therapeutic activities, and also the latest advanced technologies. This discipline is in breadth rather than in depth. Then primary care is dealing with all disciplines, all ages, all the problems, but we have our own limitation. Primary care has its own limitation. We can do maximum on no limit, but if we think the patient is in critical, in emergency situation, we have to refer the patient to the secondary or tertiary care unit. We can assess the patient in time, we can manage promptly, we can prefer timely, then we can do a referral system, and we can develop an electronic medical record system. We can develop a very good rapport, and the doctor in the community, primary care physician, becomes the community leader. He becomes the health advisor, he becomes the health manager, he becomes as an advocate, he becomes a researcher, he becomes a leader for their problems. Then someday the patient comes home, some other problem can be addressed. Primary care is one of the most likely, it is in the trend of any developing countries and developed countries. Primary care is full of strength now. Primary care can be developed as a university. We have our own department, primary health care. Within the department, we have primary care and public health. Then two things, one is PC, one is PH. Primary care, public health, and we are covering primary health care. And whatever we discuss, it is going to talk about towards the individuals, families, at last the general population. When we talk about the discipline base, we are on family medicine, we are towards community base. This is community based, population based discipline to deal the problems of health related, not only health related, behavioral science and social and financial issues. We have to manage the patient with appropriate resources. This is the well-developing, it is the newly trained. Most of the undergraduates are attending for postgraduates. Now it has come as one of the leading course in the PGIM Sri Lanka, and it is also leading employability all over the world, especially the developed countries, Canada, Australia, UK and US. Most of the youngsters are now towards family medicine because they are clinical based, community based, and the patient or doctor can help the family, the doctor can help the community, the doctor can help the health system of the country, and he can do better in the primary care as well as strengthening primary care, at the same time supporting secondary and tertiary care. Then when the primary care is on track, that is secondary care, tertiary care also on developing. That means unnecessarily burden the patient's load is reduced at the level of primary care level. Therefore, primary care should be well understood among youngsters, medical professionals, any field, because they do not understand the depth of the service. They think primary care at the primary level, it is true, but it is going to cover most of the discipline on early stages, and it is going to give a very good time for the patient to decide on the clinical problem. Then we do apply some certain strategies to make diagnosis. We make some clinical things. We do some minor surgical procedures. We undertake some emergency situation. Then this primary care is part of the health system. It is not under any system, it is with the system. Our primary care comes as a clinical discipline, as a specialty within the healthcare delivery of the health system, and it is within the system and with the system, not under or inferior to any other discipline in the healthcare delivery of any country. Primary care is the field of medicine in the future.